Hi, my name is Matt Mulcahy. I'm the Director of Business Development at ProSource, and today I wanted to talk about how we're adding exceptional value and improving patient outcomes by working with hospitals. So across the healthcare spectrum, we've been doing the generals for a long time. That might be, the IT management and support, helping with cybersecurity, move your baselines forward, making sure your technology is aligned to compliance, and helping with technology standards and life cycles to produce, budgets and forecasting, and helping with clinical systems when it comes to reviews and recommendations. Today, what we see in the hospital environment is M&A is taking over. We're seeing the consolidation of health systems left and right. What we're seeing, though, is that these internal IT teams are already saddled, and now they're getting pushed to, weave in these practices that are disparate from their technical systems and evaluating that technology and charting a course to standardize those entities on the acquirer side is a lot of work, and we're coming in to help evaluate and help with that standardization. We're also seeing with the proliferation of teleradiology and radiologists working from home that they don't want to really manage that. Those are outside the hospital confines, so they're looking to third-party providers to deploy and manage those in-home reading stations so the radiologists can do their best work from the comfort of their home. Circling back on the acquired practice support, once those practices are standardized, they're generally not really looped into the hospital systems and hospital standards for a couple of years. So there's a gap there where they're still going to need the outside provider support from generally the IT people that were doing the work already, or a trusted partner that they know they can come in and rely on to keep it afloat until they're really weaved into that hospital system. Looking at the remote workforce standards and management, more people than ever are working from home. Once again, same thing with the radiology. They're outside of those hospital walls. Sometimes we're seeing hospital groups not really want to deal with it, and they're looking for outside providers to facilitate the support and management of those systems outside of the hospital walls. Last but not least, these hospitals are expanding like crazy, these giant health organizations. And like I said, their IT teams are really focused on their internal initiatives, and they might not have the bandwidth to focus on a new build out. It's a lot of work working with structured cabling, general contractors, putting in new gear, configuring that, setting up all the computers. Sometimes it's easier just to work with an outside provider and get that turnkey experience. So this is where we're really seeing growth in the hospital sector and how we're helping hospitals manage their IT spend and be more efficient with their internal IT staff. Once again, my name is Matt Mulcahy. I'm the Director of Business Development at ProSource. And if you have any other questions or would like to chat, our contact info is below. Thanks so much. Have a great day.